Hello, I bet you're here because you're looking for solutions where the back pain doesn't limit your life anymore, your activities anymore, or maybe you're looking for help so that you don't get that surgery that they have offered you, or keep taking opioids or stop taking opioids, or don't want to take any opioids for your pain. I'm Dr. Myrdalis Díaz-Ramírez, and I want to welcome you to this class that I put together to help you understand some of the things that we do for patients in our clinic, DR2SPINE, here in Tampa, Florida. I want to tell you a little bit about what happens in a pain clinic. I've spent over 25 years taking care of patients every day, and I've learned a lot during that period of time. I've learned a lot of those patients that come and they want to be part of their family, be enjoying time with their friends. Maybe they want to carry their kids, their grandchildren, they want to work, simple things. Maybe just walk from the door to the mailbox. That's all they want. So they want to recover and be able to live and be part of society, find their purpose again. So that's what I do. I help patients do that. You might think that at the pain clinic, we want just to take care of a herniated disc or stenosis or something like that. That's not what we do. We return patients to their function at the best that we can. And that's what I want to share with you today. I've had many patients through the years, thousands of patients from the years where I was learning medicine till now. And it wasn't until I found regenerative medicine that I was wowed over 10 years ago. Pain took me to a pain clinic. I was actually in my residency when I developed pain, and it was in my hand, and I could not be writing, I could not be in the operating room as an anesthesiologist that I am, doing really anesthesia. So they sent me to the pain clinic to be able to work there, because there I could interview patients, and with the time that I spent there, I got inspired. I was able then to do surgeries. I come from a family where I grew up watching people in pain. I saw my grandmother suffer with pain. I've seen my mom suffer with pain. And then at that time, I had pain myself. So I could not be in the operating room doing things for my patients in anesthesiology, but then I learned the power of interventional pain management. And I was so excited to become one. And then I was able to do surgery, and I've done a lot of that. And then in my own quest, looking for functional medicine solutions. Functional medicine is basically, I think, the bridge between conventional medicine and alternative medicine. There was where I found regenerative medicine. It was fantastic. Our bodies are regenerating all the time. Even in our menstrual periods as women, we have our uterus lining is already regenerating. That's all regenerative medicine that's happening there. When we heal, when we break a bone, we're healing. So through regenerative medicine, we're able to do this. We have the capability of doing that. So what we do is that we take material from our own body and then we repurpose it and we put it in areas where we've been hurting for a long time. Maybe something that just happened, and we're able to help it and be either much quicker at healing, or be able to get rid of a lot of the discomfort that we've had for a long time. So finding that power, that was fantastic for me. I've been doing interventional pain management after doing anesthesiology for over 25 years, and then 10 years ago I started doing regenerative medicine. And now in our clinic in Tampa, Florida, I brought those therapies with me. But not only that, I have also put together something that I call the DR2 Restore Motion method. And why did I create that? Through all these 25 years, I saw many patients come to our clinic where they came already having had surgeries, having been on medication for a long time without healing their problems. And they never had maybe even somebody examine them, somebody put them through physical therapy, somebody really talked to them about what they were suffering with. So after seeing all those things, I thought that I could probably do better for my patients. I also saw patients who've had injections, treatments that were done without appropriate mapping of their pain. So we've put together a method, and I want to tell you all about it. But before I do that, I'm gonna give you an anatomy class. And if you didn't think that you were coming to a class, a formal class, I'm gonna give you one. So I have here the spine, ta-da! And then this spine, I'll tell you some things about it. Maybe one day I'll do a contest to name it, but for now, it's the spine. The spine, in our bodies, we have three main areas that people talk about. So we have cervical, that's the neck, cervical. So We have 7 bones in the cervical spine, the same way like a giraffe has 7 bones. They're just huge. Ours are approximately this size. We have the thoracic spine, which we have there 12 bones, and then we have the lumbar spine, we have 5 bones. So when we talk about L1, L2, L4, 5, that's lumbar. So these 5 bones. Here we have the buttocks, here we have our pelvis, okay? Our belly is here. So we have L5, lumbar 5, 4, 3, 2, 1. Then underneath here, we have the sacrum and then the coccyx, which is not here. The sacrum is S, so S1. So a lot of people have heard of L5, S1, L4, L5. So now you know why that is. What's in between these bones? A disc. The disc is like the shock absorber between the bones. Okay, so we have different parts on our spine, and they all can be a source of pain. When people go to the doctor, many times they will focus on what the MRI says. The MRI is magnetic resonance imaging. It's like a huge magnet that takes these pictures and allows us to see better the disc and the nerves in the spine and the spinal cord. It also allows us to see the bones. Better things to watch to evaluate the bones are CT scans and x-rays. Those are great for bones. We can see a lot of that in the MRI, but for the MRI is mainly the discs, the stenosis level, the spinal cord, and we do see different changes in the bones as well. So I have already told you about the different bones. So that's L5, 4, 3, 2, 1. We can have pain from the bones themselves with fractures, with degeneration, with arthritis, right? We can also have pain from the discs themselves. That is the shock absorbers. You can have a tear on the disc, and that tear can either have material from inside the disc leak and irritate the nerves, or it can have nerves grow inside and then be pinched and pressured, and then that can give pain. It also can displace and pinch either our spinal cord or our nerves. So if we take a look at this, there's that hole that goes all along. That's the spinal canal, and that spinal canal goes all along. And if it gets pinched with lack of space there in that canal, can be for many different reasons. It can be from a disc displaced, it can be from arthritis. I'll show you that in a second. Then you have what's called stenosis, which is lack of space, and that has different categories. It can be mild, moderate, or severe stenosis, and it also depends on who's reading that. Your radiologist who reads that, or the doctor who's reading it. We can all read things at different levels, but the concept will be looking for what is matching to what the symptoms of the patient are. Okay, so we can have pain from the stenosis, which is the lack of space, which can happen all the way down in the middle. Or if you see here, we have the 2 bones that come together. We have a hole here. That hole is called foramen. Through there we have the nerves coming out, and I'll tell you about the nerves in a second. But stenosis can be in the foramen right there, like lack of space there, the nerves being pinched here, or in the middle. So the nerves, they come down, and if you've heard about sciatica, for example, sciatica is basically pain down the sciatic nerve, which is down the leg. It goes from L5, that's the whole of L5, and this is the whole of S1, goes down, and it's as thick as your thumb. So if you go like on your buttock and right there in the back, it can be as thick as that going down, and then it splits into different nerves down there. But that's the sciatic nerve, and that's sciatica, pain down that nerve. If it's at this level where things are pinched and that's where it's causing the pain, is radiculopathy. So radicular symptoms, nerves, is nerve pain going down a nerve root, radiculopathy. So you can have pain down the L5 nerve, radiculopathy, because the nerve is pinched at L5S1. I will test you on that, on this, right? And then that's another source of pain. Where else can you have pain coming from? So you have the 2 bones coming together. This part is the spine. These are the spinous processes of the spine. And then we can have ligaments. We do have ligaments here, which can have tears that can cause pain. You have the 2 bones coming together, and these are the joints in the back. Those are called the facet joints or hypophyseal joints. Those are the names of those joints. When you're going back and you get more pain, right? That can be because the elements in the back can be pinched. If you turn to a side and go back, looking like that to the side, that can give you also pain. Then we're thinking that then maybe those facet joints are involved. The same way like in our neck, like if you're driving, if you had what's called whiplash syndrome, for example, you fell or had a car accident, your neck went back and forth harshly or side to side, and you are driving and then you just look like this, like you cannot just look like that, then we think, you know what, they probably have pain in those facet joints. So we are looking at the different areas of pain. And why am I telling you all this? And I haven't told you more, I'll tell you another one in a second. It's because we should treat the spine as a functional unit. It's not in isolation. The spine has a lot of things. So when you have your MRI and they say, oh, you have a herniated disc, well, if there was something strong enough to cause problems with the herniated disc, you can certainly have problems in other areas of the spine. So you might be hurting from the disc or not, or in combination with some other areas, and it's our job to figure out as a detective, which I love to do, where that pain is coming from. Another area of pain can be your sacroiliac joint, which is a huge joint. It's very well affected in many cases. So if you see here, that's the sacrum, and this is where the pelvis comes, you know, like that big bone that you have at the bottom of your body, and that huge bone comes around and then it joins here. So that joint is called the sacroiliac joint. That joint can hurt a lot, and not only that's the joint, like it has tons of tendons around here. You look in those anatomy books, it has a lot of tendons which can cause pain. You can have pain from pinched nerves right up here. You can have pain from the muscles above it, and this is all going to be very important, because if we only treat one area, we focus on that one herniated disc, we might not have treated all the pain that our patients have. So that's where this method that I'm telling you comes into play. One, we first prime that patient. We prepare them. How do we prepare them? Well, I want them to be stable. I want them to have good health. I want you to have good health, because if you don't have good health and then I do these procedures, then you might not get the benefits that you want from them. So we prime that patient. And once you're healthy, we want also to get you optimized so that you get the best out of these procedures. Maybe with amino acids, maybe with hyperbaric oxygen therapy, maybe with IV therapies, things that the patients will benefit from to be in better health, to get the best results from our method. The second thing that we do is map the pain, and a lot of that has to do with what I just showed you. Okay, I want to make sure that whatever I'm treating for that patient is very specific, is what they need. I don't want to miss anything for that patient. We want the better results long term. For us to do that, I cannot just focus on one thing. Yes, it might be the thing that's giving you most of the pain, but it might be that you still have like that 10% of pain left over, and then that 10% after we've done the 90% of your pain, that 10% becomes your 100% of your pain. So I want to make sure that we treat the most areas that make sense in your case, and that's the mapping. The other thing that we do is target. So target, we're doing our procedures under ultrasound and under fluoroscopy whenever each one is needed. Why do we do that? We do that because we want to make sure that we have the products right in the spot. Many patients have come to me through the years telling me that the doctor just palpated. You cannot just palpate. It doesn't matter how thin you are, unless like you're dying thin. You cannot palpate a facet joint, for example, and make sure that you're there. How do I know that? Because after 25 years of doing these procedures under x-rays, I take under x-rays, I look at the needle going into the bone, and still I can get there very close and not be in the joint, because I put contrast to make sure that I'm in the right spot. And I've seen through the years over and over where I think, even looking, that I'm there and I'm not. So patients that come to me and they tell me, oh, they did this, you know, they sat me on the table, they told me to go like this, and they pinched me like that, I cannot ensure that those patients had adequate injections, because I've seen it under x-rays thousands of times. Okay, so we map and we target. The other thing that we do is that we repair. How do we repair? We repair with regenerative medicine. And here's my excitement. That when I learned the power of regenerative medicine, I could not believe that we have this capability of getting these products from our own bodies, not buddy, but our own bodies, to be able to be repurposed for our healing. So we can help patients who just had something happen to them, or we can have patients who had pain for a very long time, and then get them back to a state where pain is no longer limiting their life. And that's very exciting to me. I'll give you a couple of examples. When I started doing regenerative medicine, and I laugh when I tell this story is sad, because these patients, they were part of a plane crash, like 40 years before the patient received this treatment for their pain. With me, with regenerative medicine, I did platelet-rich plasma and plasma concentrate for them, and I'll tell you a little bit more about that in a second. But I was that age when the patients came to me. I was the age, so I was born sometime before they had that plane crash. And then I was able to help them. After we did these therapies for them, they didn't have pain any longer after so many years, after seeing so many physicians, after having so much therapy, and after having seen so many specialists. We did something very simple for them and they didn't have pain anymore. That fills my heart with joy. What other cases have I done? People ask me, what do you give me what you would give your mom or your family? And I'm gonna tell you, yes, I do. For example, this year, my daughter, she's had multiple injuries through the years from her volleyball years in middle school and high school, and now she's in college. And around 2 months before I saw her, she had hurt herself in college. I could not see her for that period of time, logistics, but then she was using different braces and help to be able to walk. She came to me, we did her regenerative medicine treatment, and less than 2 weeks later, exactly 10 days later, she was not using anything else anymore. So that's what I give my own family. I trust, I know these therapists, I've been doing them for so long, and I help them. I did for her, we did the platelet-rich plasma, we did the ultrasound guidance. I did prepare her before coming to me to make sure that she was doing healthy stuff, that she was not doing any anti-inflammatory medication, for example, and she didn't do any before or after. And I guided her through the whole thing, and 2 weeks she was back to her normal, ready to then be restored because she has lost mobility. So now she's finally moving again, the same way that she was moving 2 months before this injury, almost 3 months by the time this whole thing happened for her. So yes, it does take some time to repair, but we're able to do this for our patients. So I want to tell you a little bit about who this is not for. This is not for patients who are taking, for example, steroids. I tell my patients not to take steroids for a month before and a month after. I'm super conservative because I want to get the best results for my patients. I also have them not take any anti-inflammatory medication for at least a week before and even for a month later because I want to develop some inflammation. We want the body to heal, and it takes some time. Some patients have infections. Some patients are really not healthy enough to do these procedures, either from a physical or a mental point of view. If you're having something that impairs the way that you perceive pain, we have to work on that to make sure that you're gonna get the best results from our therapies. So we try not to do that on these patients or postpone it, or we connect them with clinicians who can help them get there, optimize them, so they can come and benefit from these therapies. Let's talk a little bit about the PRP, what's PRP, and bone marrow aspiration and all these things. So platelet-rich plasma, it's a blood draw that we do from you, usually from your arm. That's the most common. If patients are having problems with their blood being drawn, I have 2 machines here that help me get that blood from those patients. So I have an ultrasound machine, and I have another one that uses a special light that helps me see those blood vessels, and we're able to do everything very comfortably for these patients here in our own clinic. So that's not a problem. So we take that. What does that have? It has platelets, and it has a lot of factors that help with healing, with inflammation, with the pain. We're able to isolate those parts from your body using what's called a centrifuge. I call it medication. I call your own blood medication. So we get your PRP, we get it from your blood. It's usually like between 60 to 120 to 180 milliliters. It depends how many areas we're going to be injecting. And then depending on the areas that we're going to be injecting, then we're also going to determine if we're going to use the platelet-rich plasma, protein concentrate, bone marrow aspiration, and if we need anything extra, like some people will want to use exosomes or cord blood for their treatments, we'll also work with those. And they're only available here in the state of Florida, and the FDA has not approved of them. We've used them successfully in some patients, and we have to talk about that in person to be able to answer any questions about that if that's something that somebody would like to consider for their treatments. So we take that blood, we put it in the centrifuge, and we separate, and then one of those parts is called the platelet-rich plasma, which is a little bit like this. When we're injecting in different areas, like I told you, like if we have so many areas, like your facet joints, your sacroiliac joints, your stenosis bothering you from a displaced disc or something like that, we might need more volume. So we do protein concentrate, which is the platelet or plasma, has like some extra liquid there, and we can get some of those items from there and then inject them as well for volume and for helping you heal. Taking bone marrow blood is just like another blood draw, but it comes from the bone. When you obtain it, it's just blood. What happens there, that's where we have a lot of your own stem cells. So if we want to go, for example, for injecting a disc, we will probably decide to use that bone marrow blood draw. And it's fantastic that we can do that. And then we have the other alternatives as well available. So with time, your body will decide, okay, here's the problem. they put this platelet-rich plasma or plasma concentrate or bone marrow aspiration or bone marrow concentrate in this area, and then there they go. The stem cells eventually come with all this food that we've given them to be able to help you. Are we gonna give you a new spine? No, we cannot promise we're gonna give you a new spine, but we're gonna work a lot in inflammation. There's some areas, for example, the tears, where you've seen those tears seal with some of the therapies that get to be done. We cannot get rid of all the arthritis, but we can get rid of a lot of the pain that many patients have. Our results vary, and they don't last forever, because guess what? We are aging all the time, right? So our bodies keep degenerating. I wish it would last like 10 years, but we don't know unless we've done some other things to help our body throughout that period of time to make it and be ready and optimize also. So we have to restore that body. We have to energize that body. We have to make sure that we're doing healthy habits for our bodies after we've done these therapies. I have patients that have come to me maybe later, a year, 2 years, because they hurt somewhere else in their body. I have some patients that during the procedure, they will come to me, and then maybe 2 weeks, they say that they feel 30% better. A month later, they feel 50% better. 2 months, they feel 80% better. And that's usually like a more normal progression, because our bodies are like regenerating and we're helping them through that process. And then I have patients that will never have to have the therapies again done. It varies from patient to patient. The great thing is that we're capable of avoiding surgery and opioids in most of the patients that we are treating with these therapies. So that's really exciting. What else can we expect from us? Well, we're here in Tampa, Florida. You can look at our website. It's DR2SPINE, dr2spine.com. You can also call us at our phone number 813-597-3405. And I am the one giving you your plan of care. I don't have anybody else. It's me, the doctor. So you can expect personalized attention. I will do the plan of care. Our guarantee is that if you come to see me and you don't like the first interaction, then we return your money, because I want a great relationship with my patients and I want whoever's working with me to be satisfied with our job. We have a webinar coming up where I can answer questions for you live. So you can expect that from me. Everything that I'm doing in this video and that webinar is for educational purposes only. So I want to educate you more about what these therapies are. If you think they might be, if we could think they could be potential therapy for you. It's not meant to be medical advice, but you can expect that I will try to answer all your questions that you have. So please join us in our webinar. If you found this useful, share it, and we'd love to meet you. We'd love to see you, and you have a fantastic day.